Okay, hi, my name is Abby Rockers. I'm going to be doing my health history video, but before I get started, I'm going to show you that I just have my rubric here. There's no writing on the front or the back anywhere, and I'm just using this folder as a holder here. Okay, so here we go. Hi, my name is Abby. I'm going to be your nurse today. I'm going to be performing a little health history assessment. Is that okay with you?
That's great.
Great. Can you give me your name and date of birth?
I am Susie Rockers, 2267.
Okay, wonderful. Perform hand hygiene. I would check her wrist to make sure that her name and date of birth matched. It does. Okay, so I hear we're having some pain. Can you tell me your chief complaint today?
My chief complaint is I've had a cold for about 2 weeks and it's turned into a terrible cough. I have coughed so hard that I think I've either pulled a muscle or broken a rib on my right side.
Oh gosh, well that's terrible.
I know, it is terrible.
So when did you notice that this first began?
Probably about a week ago.
Okay.
It's gotten bad.
A week ago. And I know you said it's on your rib. Can you point to the exact location for me?
Right here.
Right there.
It's
Okay.
like a little indention too, so
Okay.
I need to get that checked out.
Well, I will note that and have the doctor definitely check that out too.
Okay.
What is the duration of it? Does it hurt all the time?
Mainly when I cough or sneeze.
Okay.
And when I lay on my right side in bed.
Okay. And would you say, like, when it is at its worst, how long does that pain usually last for?
However long my coughing spell lasts, 20 seconds.
Okay. And what are the characteristics of it? So, is it a dull pain? Is it sharp?
It's
Shooting?
dull most of the time, but when I am coughing, it is a excruciating pain. Like
Okay.
on a scale of 1 to 10, it's a 10.
10. Okay.
Yes.
And are there any other associated manifestations? So, meaning, are there any other pains in the rest of your body that you think is accompanying this rib
Yes.
issue?
Sometimes when I cough, it moves to my back, and
Okay.
I can just feel that's probably muscular. It's muscle related, but it will shoot to my back.
Okay. Now I know you said when you laid on your right side that made it hurt worse, but is there anything that is a relieving factor that makes it feel better, or
Heating pad.
Okay.
A
Heating pad
will
makes you feel
help
better.
it. Mm-hmm.
Is there anything else that makes it feel worse when you're standing or sitting or
No, just basically.
activities?
Well, I can't exercise because it hurts too bad to
Okay.
exercise. So no
Okay.
exercise.
And you said you're using the heating pad. Are you doing any other kind of treatments for this?
I'm taking some Motrin.
Motrin.
Yep.
Okay. And
3 of those every 6 hours.
3 Motrins every 6 hours. Okay. I'll write that down. Is there any other medications that you're currently on?
Yes. I'm on 2 heart medicines.
Okay.
Atenolol, 25 milligram.
Okay.
Digoxin, 25 milligram.
Okay.
I'm also on an Armour. It's for my thyroid.
Okay.
I'm on Keppra for temporal lobe seizures.
Okay.
And I think that's it.
That's it. Okay. And are you taking any other supplements that aren't
Some
necessarily
biotin,
prescribed? Biotin.
just for my hair.
Okay. And how much of that would you say you're taking?
Biotin?
Yeah, like the dosage on
I
that.
think it's 5,000 whatever mcgs or something like that.
Okay. And do you have any allergies?
To medicine?
Medicine, foods, seasonal,
Codeine is the
Animals.
medicine I am allergic to.
codeine.
Mm-hmm.
Okay.
That's about it. No
So is that-
seasonal allergies. No.
Okay. So can you give me any other medical history of yours besides this issue you have going on?
Well, starting on my head, about 20 years ago, I had a cyst on the posterior fossa of my brain,
Okay.
which required 2 brain surgeries.
Wow. Okay.
So I'm fully recovered from that. I was in a car accident and I broke C7T1.
Okay.
I've had some lumpectomies under both of my arms.
Okay.
I have had partial hysterectomy and a myomectomy to remove fibroid tumors.
Okay.
I've had 2 orthoscopic knee surgeries,
Okay.
and I think that's about it.
Wow, you've been through quite a lot.
Yeah, it's all turned out well though.
Well, good. I'm glad to hear that. And vaccinations, are you up to date on those?
Yes, I am.
Okay. Very good. And do you have anybody else in your family history that had any other health issues?
My dad's had 2 minor strokes.
Okay.
My mom had 1 TIA. My dad has high blood pressure, which he's on medicine for.
Okay.
And other than that, everybody's pretty healthy. Oh, my mom has a thyroid
Thyroid issue or?
issue. Yeah, she had hyperthyroid, and they killed her thyroid off
Wow.
with radioactive iodine.
Okay.
And so I think that's where I inherited maybe my thyroid problem.
Okay. And is there anything else with your personal or social history that you could share? Family, past?
I've been married 26 years to my wonderful husband. I have 3 beautiful kids.
Okay. Wonderful.
I work full time, take care of my mother-in-law, keep up with my kids' lives and activities, and that's about
Any
it.
hobbies you enjoy?
I like exercising when I have time.
Okay,
I
good.
just don't have a whole lot of time lately. Plus,
Okay.
my rib is hurting, so
That's right.
I can't exercise.
Well, hopefully we'll get that feeling better.
Yes.
Is there any general issues that you've noticed lately? Have you had any weight gain or weight loss? Anything like that?
Probably a little weight gain just because I haven't been able to exercise like I want to because
Okay.
of life and my rib.
Okay. Any hair loss or anything like that?
Nothing. There was a little hormonal
Okay.
problem with it when I started menopause, but
Okay.
it's gotten a little bit better.
What about your skin? Have you noticed any rashes?
No, dry skin in the winter, so I just put lotion on.
Okay, dry skin. Have you noticed any like abnormal moles or anything like that that
No,
popped up?
I was a lifeguard for 12 years, so I do regular skin checks at the dermatologist every 6 months, and she's always very good about checking anything I have questions about. But no,
Oh, good. That's great that you're getting that checked out. Have you had any head trauma?
yes, when I
Injuries?
with my car accident, when I hit the windshield, I had to get stitches on my forehead, and then head injuries with just my cyst removal.
Okay.
So I have a scar from here all the way down to the middle of my neck.
Oh my goodness.
Yeah.
That's pretty large.
It is.
What about your eyes? Did you have good eyesight?
I think sitting in front of a computer for 8 hours every day at work has made my eyesight get progressively worse.
Okay.
I need readers for work and just around the house. I've gone to an eye doctor. He put me in contacts. They made me dizzy, so I haven't worn those.
Okay.
Yeah.
So just readers, but not currently wearing the contacts then.
That is correct.
Okay. Have you noticed do you have any eye pain, dryness, anything
I
like
would
that?
just say tired eyes,
Tired eyes.
fatigue.
Okay. Have you noticed any hearing loss?
A couple
hearing
years ago, I
deficit?
had a tinnitus, constant ringing in my ear. I had an MRI because they thought maybe it was something with my cyst or something, but everything checked out fine, and the buzzing went away. So I'm
Well,
good.
good.
Yep.
Any dizziness?
Occasional vertigo with, I think, just the changes in my fluid in my head from my cyst. But
Okay. And any infection? Do you regularly have ear infections?
Nope.
Okay. Very good. And your nose. Do you have any sinus issues?
Nope.
Okay. And no recent colds or anything like that.
well, actually, yes.
Right.
The whole
That's caused
thing
everything.
that's caused my cough and my rib
Okay.
injury.
And your throat. Have you had any sore throats
Sore throat was associated with my illness.
with everything else? Okay.
Mhm.
Bleeding gums. Have you noticed?
Nope.
Canker sores. Do you get those?
No, I do not.
Okay. Very good. And so with your neck, have you noticed any swollen glands? Anything like that?
I occasionally will get those when I get sick, but it's nothing bad right now.
Okay. What about a goiter?
I had a goiter when I had my first child. A month
Okay.
after he was born, I noticed a big lump, and that's when I discovered my thyroid problem. And so I've been on thyroid for 26 years.
Wow.
Yeah.
Okay. So with respiratory, have you said you've had a cough? That's kind of what has caused all of this.
Mm-hmm. Yes.
Is that still persisting? You
It's
still
getting
have that?
better. All of those symptoms have kind of cleared up, minus my rib. That's my only complaint.
Okay. And do you have any trouble breathing?
No, at first I did, but that
Mhm.
has kind of resolved.
What about any wheezing?
Nope.
Have you had a chest X-ray?
No.
No chest X-ray. Okay. Have you had any heart problems?
I do have heart problems. He said I do go to a heart doctor. He said my heart is very healthy. My electrical system is messed up.
Okay.
So I am on the heart medicines for mitral valve prolapse,
Okay.
PSVT, arrhythmias, and palpitations.
Oh wow. Okay.
But all are controlled with my medicines.
Okay. And do you have any chest pain associated with that?
Occasionally with a mitral valve.
Okay.
If I get the stick, but I know how to get rid of that. So.
Okay. And your blood pressure is
Very low because of the atenolol that I'm on.
okay.
So
Very
like
good.
80/50.
Wow. Okay. That is pretty low. And your GI tract, do you have regular bowel patterns?
I'm kind of constipated at times, but I take Miralax at night.
Okay. Very good. Have you had any gallbladder or liver issues?
No.
Have you ever noticed any blood in your stool?
Nope.
Okay. And you have no nausea, vomiting,
No.
no changes in appetite?
No.
Okay. Very good. Have you noticed any varicose veins forming on your legs?
Yes, on my right leg especially. They're
Okay.
kind of deep, and they make my ankles swell occasionally, and just like a dull pain.
Okay. So you do have pain and swelling associated with that.
I do.
Have you ever tried to wear tights or hose
The
to
support
help
hose
those?
I wore with my third pregnancy, just because the veins were starting to bother me. It hurt,
Okay.
but not recently. I haven't.
Okay. And with your urinary system, do you ever have frequency or urgency to go to the bathroom? Any issues with either of those?
I drink a gallon of water a day.
Well, that's very good.
Yeah, but I don't have to. I would say maybe 7 or 8 times a day, but like no really sense of urgency.
Okay. Well, that's wonderful. And you don't notice any kind of dribbling or anything like that with coughing or exercising?
Nope.
Okay. I know you, besides your rib pain, are you having any other muscle or joint, bone aches?
Well, I'm getting to the age I think arthritis is starting to set in. I can tell when it's going to rain
Okay.
because my knees hurt and my wrists kind of hurt.
Okay.
I have herniated discs in my lower back,
Okay.
and so occasionally those will slip out of place, and I'll be down for a couple of days.
So some lower back pain then?
Lower back pain, yes.
And when that's at its worst, is that pretty severe pain?
Yeah, like I'll need a heating pad, a lot of Motrin,
Okay.
and then just a couple of days of just moving very slowly and taking it easy.
Okay. And have you ever been diagnosed with depression, anxiety, any other kind of psychiatric?
No.
No?
Pretty
Okay.
happy most of the time.
Very good. Very good. And then have you had any kind of, notice any bruising on your body?
No.
Okay. What about anemia, possibly?
I've tried to give blood in the past, but now that I'm on medication, I can't. But previously, I was not able to give because I was anemic.
Okay. And no bleeding gums or
No.
anything like that?
No.
Okay. What about seizures, fainting? Have you had any issues with that?
I have had seizures, and it took about 15 years to diagnose them.
Oh, wow.
And that was not a lot of fun, but they finally did diagnose me with temporal lobe seizures.
Okay.
And so I'm on a low dose of Keppra, and it totally controls them. So I'm very thankful for that medicine.
Wonderful. Okay. And I know you said you had thyroid problems. Hypothyroid?
Mhm.
Okay. And do you feel like you have a temperature regulation issue
Yes,
at all
I am
with your body?
always cold,
Always
unless
cold.
I'm having a hot flash. And then I'm really, really hot.
Okay.
And then after that goes away, then I go back to being really cold again.
Okay.
So,
Have you noticed any abnormalities with sweating? Like, do you sweat too much or too little in
no.
comparison to what you used to?
No.
Pretty normal still?
Yeah.
Okay. Well, thank you for giving me all this information. I'll pass it on to your doctor, and he'll be in a minute to hopefully figure out what's going on with your rib and get that fixed for you.
I hope so too.
All right. Do you have any questions for me?
You did a good job.
Okay, great. Thank you so much.
Thank
Great
you.
meeting you. Have a great day.
Nice meeting you.
Thank you.